Electrostatics in the medical field is the topic of this video, as I am interested in a future in the medical field, so I wanted to inquire deeper into a subject related to that, and while making my previous lesson, I began learning about the uses of electrostatics in the medical field, so I decided the question I wanted to further inquire into is again, electrostatics' purpose in the medical field. Quickly, before we get into the medical part and its linked to electrostatics, I just want to give a quick breakdown of what electrostatics is. Electrostatics, or static electricity, is the study of electric charges at rest. It is a branch of physics that deals with the forces that electrically charged particles exert on each other. The study of electrostatics helps us understand how electric charges interact with each other and with matter, and how they can be controlled and manipulated. In this lesson, we're going to be learning about 3 different ways of how electric statics is being used in the medical field. Let's start getting right into it, starting with electrospring, which is similar to electrospinning. Electrospinning is a method for producing very small droplets of a liquid using electrostatics and more. In electrospring, a high voltage is applied to the liquid to be sprayed, which causes an electric field to be established around the liquid. According to Coulomb's law, the electric field is proportional to the charge density and inversely proportional to the distance from the source of the charge. So in electrospring, the electric field is high near the tip of the needle and low at the surroundings. As the liquid is drawn out of the needle, it is subject to the electric field, which causes it an electrostatic force to be exerted on the liquid. This force acts on the liquid droplets, pulling them apart from the needle and causing them to be pulled apart into smaller droplets, which we can see happening in this image where the high voltage is applied and the liquid that's being exerted through the needle is being turned into smaller ones. The size of the droplets that are produced is determined by the strength of the electrostatic force and the properties of the liquid, such as its viscosity and surface tension. Electrospring can be used for inkjet printing and its material synthesis. However, we are going to focus on its uses on drug delivery, as that's the main relation to how it's being used in the medical field. Electrospring is a technique that can be used in the field of drug delivery to produce fine sprays of drugs that can be inhaled by patients. The small droplets produced by electrospring can be directed to specific areas of the lungs, allowing for more efficient delivery of the drugs. Additionally, electrospring can be used to create nanoparticles for drug delivery, which can target specific cells or tissues in the body. One of the main advantages of electrospring for drug delivery is that it can produce droplets with a high charge to mass ratio. This high charge to mass ratio allows the droplets to be directed and focused by applying a surrounding electric field. This means that the droplets can be directed towards specific areas of the lungs or even other parts of the body. Here is an example of that I created. The blue particles represent particles created by electrospraying that are positive, and the positive charge on the outside can be used to direct these charges to specific areas in the body. For example, this positive charge is causing these blue particles to come down and then be pushed to the left side of the lung. If this was a negative charge, it would cause these particles to move to the right side of the lung. That is how charges on the outside can be used to direct particles created by electrospring to specific areas on the body. Another advantage of electrospring for drug delivery is that it can produce droplets that are very small, typically on the order of micrometers or even nanometers in diameter. This small size allows the droplets to remain suspended in the air for long periods of time, which increases the chances of them being inhaled by the patient. Additionally, the small size of the droplets increases the surface area to volume ratio, which increases the amount of drug that can be delivered per droplet. In addition to inhalation, electrospring can be used to create nanoparticles for drug delivery that can target specific cells or tissues in the body. This is done by encapsulating the drug within the nanoparticle, which can then be directed towards specific cells or tissues using an external magnetic field or other targeting mechanisms. This targeted delivery increases the effectiveness of the drug by delivering it directly to the area of the body that needs it while reducing the side effects. Electrostatics is also used in the medical field in a new invention that utilizes electricity to heal wounds. In 2003, it was found that applying an electric field to a site of a wound can speed up the healing process by 13 to 50%. Electric fields are useful as electric stimulation is linked to the migration of keratinocytes, which help with the healing process. New research has found a way to create electrically active wound dressings that are non-invasive, cost-effective, and are better at treating wounds than regular bandages. These bandages are made of 4 layers. The first layer consists of electrically charged polytetrafluoridethylene plastic, which has the ability to generate an electric field. When placed in contact with skin, the second layer is a flexible silicone rubber, while the third layer features a shape memory alloy. This layer helps push the wound closer together and further aids in the healing process, and is triggered by skin temperature. A final layer of skin gel sits on top. Charged polytetrafluoridethylene plastic, which has the ability to generate an electrostatic field when placed in contact with skin, can do that because polytetrafluoroethylene is a highly nonpolar material and has a very low dielectric constant and loss tangent. This means that it has a very low ability to store electric energy and a very low ability to dissipate electric energy as a heat. As a result, when polytetrafluoroethylene comes into contact with skin, it does not easily transfer electrons and builds up a static charge. The accumulation of the static charge creates an electrostatic field. These dressings are known as electromechanical synergetic dressings, and there are 2 versions, one for circular wounds and one for rectangular wounds. Generating an electric field at a wound is useful as it helps increase blood flow, which helps bring more oxygen and nutrients to the area. It can reduce inflammation by stopping the production of pro-inflammatory molecules, and it can help stimulate the production of collagen and growth factors. Growth factors help in the proliferation and differentiation, and collagen helps to form new blood vessels and tissues. Here are 2 images. The first one is how a circular wound and the linear wound that were tested, and we're going to look at that in the next slide. And this is how the wounds are created, and using the bandages, this is how they can be healed with leaving a minimal injury after the bandages have been placed. Here are the 4 layers that make up the bandage: the polytetrafluoride electric thin film, the EcoFlex, and all these things. And then the EMSDC and the EMSDL are the 2 different type of dressing. The circular one for circular wounds and the rectangular one for the linear wounds. The wound healing properties of the dressing were put to the test on around 50 rats. They anesthesiated the rats before giving each either a 1 centimeter long linear wound or a 0.8 centimeter diameter circular wound, and then either applying the new electric dressing, applying a standard dressing, or leaving them to heal by themselves. We're going to focus on the rats that received the 0.8 centimeter diameter cuts. The rats that had the circular wounds and received the electric dressing were 96.8% closed after 8 days, compared to 76.4% and between 76.4 and 79.9% for the rats that received other dressings, and rats that just received no dressing and had the circular wounds had only wounds that were closed 45.9%. Moving on to the final connection we are going to cover between electrostatics and the medical field, being electric stimulation, also known as e-stim. It is a medical treatment that uses electric current to stimulate the activity of cells in the body, such as nerve cells or muscle cells. This can be used to provide pain relief, help with muscle recovery, rehabilitation, stop spasms. The basic principle behind electrostimulation is the use of electric current to stimulate the activity of the cell in the body. Electric current is a flow of electric charges, and when it passes through a conductor such as a nerve or muscle cell, it can cause the cell to become more active. This is because the electric current can change the electric potential of the cell, which in turn can affect the chemical reactions that take place within the cell. The current is applied via electrodes which are placed on the skin. The electrodes are typically made of conductive material such as metal or a conductive gel, and the current flows through them and into the tissue beneath them. The amount of current that flows through the electrodes is determined by the voltage applied to them and the resistance of the tissue beneath them. The picture here is an example of a neuromuscular electrical stimulation, or NEMS, and in the next slide we're going to look at two types of e-stim, and one of them being NEMS. Now let's look at those two types of e-stim, starting with transcutaneous electrical nerve stimulation, or TENS. TENS is a therapy that uses low voltage electric current to stimulate nerve cells and provide pain relief. The electric current is delivered to the area of pain via electrodes placed on the skin. The current can help to block the pain signals from reaching the brain, which can reduce the perception of pain. Another application of e-stim is neuromuscular electric stimulation, or NEMS, which is used to help with muscle recovery and rehabilitation. NEMS uses electric current to stimulate the muscle cells to contract. Contracting the muscle via electrical stimulation helps improve the way your affected muscle contracts. A physical therapist can change the current setting to allow for a forceful or gentle muscle contraction, which can help to improve muscle strength and promote blood flow. It can also be used to stop muscle spasms by tiring the muscle out that spasms. Risks of using e-stims, so TENS or NEMS, include muscle tearing, skin irritation, and tissue burns, which are all caused by having too great of an intensity of a current put in. There are more examples of e-stims, but these are two specific and two of the biggest ones. TENS especially is the most common one. I just quickly wanted to show an example of a TENS device that my grandma uses to help with her pain as well. So this is the main compartment, which is used to choose between a bunch of different settings where you can change the strength or the different modes of the TENS device, depending on where you're going to apply it to your body. You can set a timer as well. And then these are the electrodes, and they have a gel on them, but because they've been used a lot, they've gotten less strong and have a harder time sticking to the body. You can attach them, like if I attached it onto my hand, and you'll start feeling a little bit of a current there. This TENS devices have a lower current output, so they can't really do any harm to you, and the stickiness of these are really worn out, so they don't cause any skin irritation or anything. So the current goes through the wire into the electrodes, and when you apply it to your skin, it goes into your skin. So this is just an example of a TENS device. That concludes this presentation video, and I hope you enjoyed it. And if you have any questions, please leave them in the comments or just message me.